Hello, everyone. My name is John Barrows. I am the President and CEO of the International Eye Foundation, and it is a privilege to be the chair of the Vision 2020 USA. Vision 2020 USA is a member organization of 48 organizations with a common interest in promoting vision and eye health in the USA. First, I want to begin by thanking our members who have sponsored this year's event and all of our members. Your contributions are highly appreciated. Today, we celebrate World Sight Day. World Sight Day is an international day of awareness held annually on the second Thursday of October to focus on global issues of visual impairment and avoidable blindness. Every year, Vision 2020 USA conducts a congressional briefing as a moment to highlight topics on visual health that are important to our organizations, beneficiaries, collaborators, and government officials. This year, our approach is different than in past years. This year, we are presenting the second of a four-part webinar series to discuss access to eye care and advocate for improving our services. It is a pleasure to have you join us today. Today's topic is building stronger systems to advance health equity in pediatric eye care, call to action from a doctor and a parent. This webinar will be recorded and available on the Vision 2020 USA website. Our moderator today is Dr. Joy Harewood, the inaugural Director for Diversity, Equity, Inclusion, and Belonging at SUNY College of Optometry, where she also holds the title of Associate Clinical Professor. She also has extensive experience in hospital-based eye care, and as a clinician and educator, she is a leading voice advancing diversity, inclusion, and equity in the optometric field. Dr. Harewood, please feel free to provide additional background on yourself and introduce the panelists. Thanks.
Thank you very much, John, and happy World Sight Day to absolutely everyone. I'm incredibly privileged to be joining you today. Now, I think that introduction of myself was excellent, so I won't add anything to that, but I will hand it over to my esteemed panelists who you're going to hear from today. And I'd really like them each to introduce themselves and maybe say why this particular topic is important to them and how they relate to the pediatric eye care field. So if we can start, Dr. Megan Collins, would you like to start?
Sure, absolutely. Can you hear me?
Absolutely.
Happy World Sight Day, everybody. Always a wonderful day to celebrate, and I'm really grateful to be part of today's panel on such an important topic. I am a pediatric ophthalmologist at Johns Hopkins Wilmer Eye Institute. I've been practicing here for about 8 years. And in my area of research, which we'll talk a little bit about today, is school-based delivery of vision care and thinking about the role of that in addressing some of the pediatric health disparities that we see in terms of children accessing the care that they need. So happy to be part of today's discussion and talk about this topic further.
And Ms. Stephanie Klas, welcome. And if you'd like, introduce yourself.
Thank you, and good morning to everyone. I'm also extremely privileged and honored to be invited to speak with you guys today about an amazing topic on such an important day. So my name again is Stephanie Klas, and to introduce myself, because I'm here as a parent panelist, I'll share just a slight bit of my story, and of course, throughout our discussions today, you'll hear more about my journey in the vision arena with my family. So my involvement with pediatric eye care began about 19 years ago with my oldest son. He was almost 3 at the time, going to preschool a couple mornings a week. And his teachers there suggested that we have his eyes checked because he was looking at stuff very close up, his toys, books that they would introduce and stuff like that. I had noticed that at home, but really never identified it as a problem. And he had never missed any of his developmental milestones. So that wasn't a trigger that I had been aware of. So we went and had his vision tested. And after being referred to a specialist and undergoing a number of tests, he was eventually diagnosed with bilateral optic nerve atrophy. So this is a condition that is uncorrectable. And we weren't sure about the progression at that time. Thankfully, it hasn't progressed. And his acuity was about 2400 bilaterally. And that's, again, thankfully where it remains today. So that's where my vision journey started. Over the years since then, I have become an advocate for him. That's been my biggest role in my vision journey, to make sure that Brandon could be successful at school, have all the opportunities other kids could have, and ultimately so that he could get a job, enter the workforce, and be happy and successful, what we all kind of wish for all of our kids. So I got involved with lots of different organizations over the years. I did preschool vision screenings with my local chapter of Prevent Blindness. I worked with the Foundation for Fighting Blindness on their walks. I did a number of presentations on assistive technology for the visually impaired at different conferences. I'm a proud graduate of the National Prevent Blindness Aspect Program, which focused on advocacy, empowerment, communication, and training. And throughout my professional life, have had the opportunity to kind of indirectly advocate for those with vision loss and other disabilities. I worked at Apple as a trainer for a number of years, and I also worked with a company called Adaptive Technology Resources. So all my experience with Brandon, and then, reaching out to the community and becoming active, prepared for me for my family's second diagnosis, which was my younger son, Hunter. He was diagnosed just 2 years ago at the age of 18 with keratoconus. That's a condition where the cornea bulges and it becomes cone-shaped, and his vision is obviously affected. His condition had advanced quite rapidly. He had his annual eye exams, or his pediatric visits annually, and eye exams every 2 years. Because we were in the middle or beginning of the pandemic, that one exam was delayed by 6 months, but that was enough time for it to kind of progress. And luckily, he's been able to, and fortunate enough to be able to have some procedures called cross-linking to kind of stop the progression. His sight is improved with a contact that he's able to wear. And so, we're very fortunate. But his experience, or our experience with his vision, really underscores the importance of early detection and of access and availability of treatment options, because both of those things really literally can save sight. So I'm very excited to be here today, and we'll celebrate World Sight with you today and share a few more of their experiences as we go on.
So thank you very much for both of those answers. And we'll get a little bit more into some of those things now. So you alluded to it, the both of you, but let's really answer the question: why is children's vision important? Why is pediatric eye care important? And are there any reasons or any ways that a child can have trouble with educational development if those needs are not addressed? And I'll start with Dr. Collins.
Sure. And honestly, we could spend the entire session on this one question. And when I think about pediatric vision, I think about sort of the developmental progression. So there are certain conditions that are really important to think about, and children are at risk for if they've been born prematurely. Something called retinopathy of prematurity is something that we see in babies born usually less than 31 weeks of age. Then we have a whole number of eye conditions, such as Stephanie experienced with her child. They have a congenital eye condition. It's something that's often asymptomatic when kids are very young because they have two eyes, and if they have a problem with one eye, they don't know that there's something going on with the other eye unless they sometimes, honestly, we see these things around Halloween, because if a kid dresses up as a pirate and patches their better seeing eye, that is often when we see some things manifest. But those are some of the early conditions that we think about. And then once we get into a little bit older, we start thinking about conditions like strabismus, which is misalignment or crossing or drifting of the eyes. And then, of course, uncorrected refractive error, which is a need for glasses. One of the reasons that vision care is so important and detecting vision problems early is so important is because of a condition called amblyopia. And amblyopia is essentially an irreversible loss of vision if you don't detect certain vision problems early enough. This is not all vision problems, but sometimes if you happen to have a turning of the eye, or you have a cataract or a droopy lid or something that's blocking the ability of light to get into your eye, or you have a high amount or unequal refractive error between the two eyes, and you're less than the age of 7 or 8, the detection becomes so important, because say you don't have any type of detection before that, and it doesn't happen until you're 12, 13, the ability to intervene and treat that becomes markedly diminished. So I'm kind of highlighting the spectrum of eye conditions that you can have, and why is it important to know these things? First, there are so many of them that are treatable, and there are things that we can do things about. And Stephanie has given 2 examples, one of a child who has optic nerve atrophy, that there's something that we can't do about, but then her other son has keratoconus, and there's tons of new technology coming online, including the collagen cross-linking that he's already had, that is helping optimize vision for people who have keratoconus. So one is to make sure that we detect people so we can get them in early enough to get treatments. But Joy, as you're alluding to, vision is important for us seeing and engaging in the world. Turns out it's also important for kids as they're going through their learning developmental spectrum as well. So children are learning to read when they are in pre-kindergarten, kindergarten, and first grade. If they are having difficulty seeing letters, if they are having difficulty seeing the board, not only does that impact their visual development, but it can also impact their learning development. And I call it sort of the amblyopia equivalent. It turns out if kids can't read or don't know how to read well by 3rd grade, their academic trajectory is markedly changed. So there's multiple reasons why it's important to recognize and intervene early with eye problems in children.
Absolutely. Same question for you, Stephanie.
Yeah, I can't emphasize enough how much prevention and early intervention can make, just a huge difference in a kid's life and educational journey. Our eyesight, or good eyesight, is a gift, but people that have it, I believe, take it for granted. And that becomes apparent to me, obviously, when I have children that don't. But the impact on learning is tremendous. And you see lots of different statistics thrown out there, but some of them are like 80% of learning is visual learning for school. Well, imagine that being impacted or taken away and how difficult that becomes. I thought I'd share just a little bit of Brandon's school adaptations or trajectory with you to give you an idea of someone that doesn't have his vision corrected or can't have his vision corrected, and some of the impacts that entails. So with Brandon's vision, for him to read text or a word, it probably has to be about a 48 size font. So when he was little and there were 2 words on a page and they were big and black and bold, that was great. He could read. But as soon as you started getting 3, 4, 5 words on a page, it became impossible for him to read with his eyes. So, there my go-getter mom, writing out the words on another piece of paper and taping them down there in black ink so he could actually hold the book and read it. Well, that only lasted for so long, obviously. You just can't keep up with that. So he moved into using something called a CCTV, which is like an electronic magnifier, a large one, where he could put his books underneath it and enlarge it and read them there. That was great, but that's in one place, and he can't take that into bed with him very easily or move around. In school, that became difficult because he had a huge CCTV, which one made him look different from other kids. Thankfully, he was agreeable to using it, but as he started to move around with classes, he couldn't use that. So we had to decide if he was going to need to be a Braille user or use technology. We used technology for him. So by 3rd grade, he was using a computer full time to be able to read. And that doesn't seem like anything extraordinary today, but that was 20 years ago, and we didn't have iPads and computers in the classroom. The teachers were barely using them. So we had our own password at the school photocopier where we could take any book, any handout, because then at that age they had lots of handouts as well, scan it in as a PDF and send it to Brandon's computer so he could open it up and read it and access it. He doesn't write either. He can print, but he can't reread his own writing. So he can't complete things by hand in school. So again, he uses his computer for everything, iPad for some things. So all of the material he has to access, whether it's reading or writing, is digital and auditory for him. So as the textbooks got bigger in higher grades, he uses audio textbooks with print so he can follow along with a really large font size. So a very different type of learning. Another thing to think about is what can he see in the classroom, especially when he was young? He didn't see the chalkboards. He didn't see handouts. He didn't see the clock to see how much time before lunch. He couldn't see expressions on people's faces. So all of those things impacted his learning. The other thing that I will just briefly mention is it takes him a tremendous amount of time to accomplish what another child would do. Let's say in 10 minutes, it might take him half an hour or longer, not only from the preparation standpoint, but just even getting through it. He's gotten really quick, obviously, at his auditory skills. They're amazing, and he's a very good listener. But just from kids shouldn't have to deal with that when they're going through school. It puts them at such a disadvantage. So as you know, everyone has said, and Dr. Collins has said, it is imperative to find those things early and diagnose them and hopefully treat them so that they don't become more of a learning problem as kids get older.
So we've definitely focused on the individual, and I'd like us to zoom out a little bit and think about the broader social impacts that potentially these visual issues beginning in childhood can have. Any comments, Dr. Collins?
Well, I was gonna, I was gonna react a little bit to what Stephanie said because I thought it was so important to think about this, and it's always sort of a reality check for me as a pediatric eye care provider of do I talk to my patients and their parents who have low vision about low vision resources and how they're doing in school. And I would say broadly, I'm not sure if all pediatric ophthalmologists do that as much as we should. And it becomes so important when we think about, as Stephanie's underscoring, the educational and the academic implications for kids, and the hill that they have to climb is that much steeper. And recognizing it and providing the systems within healthcare and within education to support that becomes so imperative. We have, we have children who have vision problems that end up not getting a screening or an eye exam, and they end up, being sort of streamlined in school into being a struggling learner. And it may simply be that they have an eye problem, or they have an eye problem and they are a struggling learner, and making sure that they have the resources. When I listen to Stephanie's experience of the technology that she explored for her child, I think about, sort of the differential provisions of services across districts here in Maryland alone, where I have some parents who say they have absolutely wonderful services within their school system, within their district, and others that it's markedly limited. And even taking it a step further of what has the pandemic done with that, and virtual learning for students who have any type of visual impairment and how that's been impacted.
Yeah, for sure. I'd like to hone in on one thing you said, really about just remembering to ask those questions and have those conversations. Do you think that's something that we should be incorporating more into teaching, into education, when it comes to teaching providers how to talk to patients and parents?
I 100% think so. And I actually think in the attendees here, I see Dr. Guo, who's one of my colleagues. She's a postdoctoral fellow at Johns Hopkins, and she and Dr. Judy Goldstein have led a recent study that I think just came out about harnessing the electronic medical record for reminders about talking to patients or whether or not they need low vision referrals. Because we have such a compressed amount of time with patients, and we're trying to do so many different things. And I admittedly will think sometimes I'm closing my chart after the patient has left the office, and then I think, oh man, this kid's got 2100 vision in both eyes, and I didn't ask about school. So I think there's some use of electronic medical records to give reminders. But I think in general, if we bring this more into our teaching of our residents and our fellows and to our colleagues, I think that will help improve the system. On the flip side, I would say encouraging teachers and educators to talk to parents about any medical issues, but particularly vision and hearing, and understand whether there may be any factors at play that is impacting a child in the classroom.
Right. Now, Stephanie, do you have any comments on the broader social impact you think it could potentially have, children's vision?
Yeah. When I was preparing for this question, a couple things came to mind. First of all, another colleague or someone from Prevent Blindness had tipped me to the Vision Loss Economic Explorer on the CDC website, which is a really cool little tool. So what that does is, it was a 2017, and it explored the economic impact of blindness or low vision. So, but you can kind of narrow it down. So I did it for Brandon so obviously year 2017, he was 16 at the time, and they break it down into 4 categories. So he was in males 0 to 18 years old. So there was a medical costs that they assigned to him, which was 2,200 to 25. There was productivity, which was reduced work, wages, stuff like that. It was fairly high, 9,800 to 10,000, which didn't totally fit for me. Nursing home, 480, again, not appropriate for his age group. And then supportive services, which was like special ed services. Brandon got orientation and mobility. Brandon had a vision teacher. Brandon had technology costs, as I've alluded to. They said between 0 and 990, which to me, the productivity and the supportive services should be flipped for him. But anyways, the total cost for that year was $13,990. So in Wisconsin, which is where I live, there were about 5,400 males between 0 and 18 that were identified. So their cost was $76 million just for those kids in Wisconsin. So obviously we can do the math or extrapolate that to other people. So one, broader social impacts, huge costs that are incurred. The other thing I wanted to mention is mental health. So 1 in 4 children, or 1 in 4 adults with vision loss, have anxiety or report anxiety or depression. Some places say that this can be higher in children because they don't have the skills or the self-management coping techniques to deal with that. So Brandon experienced anxiety probably throughout sometime in middle school and you never know the exact cause, but I do believe it was somewhat related to his vision, and he didn't have the coping skills. Social situations were overwhelming. Large crowds were overwhelming. Big events in the school gym where he couldn't identify people or see things. A lot of stuff was overwhelming. So, that's a consideration which has been exponentially increased with the pandemic as well. And then the third kind of larger, broader social aspect, and we talked about this with school and not being successful at school. Well, what does that lead to? That leads to unemployment a lot of times. And so the unemployment rates for people with vision loss or blindness are unfortunately really, really high. Some estimates up to about 70%. And, some of the reasons, lack of transportation, lack of training, negative attitudes around people with disabilities or vision loss, and lack of accommodations. Some very quick examples, as Brandon he is in his last year of college, graduating this year, yay! But anyways, some of his experiences as he's been looking for internships in the summer. 2 years ago, he was automatically disqualified for many internships because he didn't have a driver's license. Even though the job didn't really require him to be driving, it was just a check mark, which kind of disqualified him. He had a internship this last summer, but within about 3 weeks, it became very clear to him that the store that it was within, it was a management internship, was unfortunately not accessible for him. It was not accessible as a customer, and it wasn't accessible in his role. The things he had to do, a lot of paper and handouts that he had to do. And he actually had to leave and bow out and have discussions with them about why he couldn't continue. So just a lot of discouragement that way. So anyways, those were the things I thought of: mental health, the economic cost of vision loss, and the unemployment statistics that are hard to overcome sometimes.
There are so many different elements with what
Yeah.
you both said that we could talk the entire webinar about, particularly when we're talking about mental health, especially when you start thinking about the inequitable distribution of resources and how people who are not resourced may have an even harder time even getting access to an internship, whether or not they have visual issues. So there's a lot we could talk about, but I do want to step back a little bit and talk about your own experiences providing or accessing care, and whether they've been positive or negative, and if you think that there are ways, system level ways, that you'd recommend to change so we can better serve our pediatric population. And I'll turn it over to Dr. Collins first.
I'm going to talk a little bit about some of my work in the school age population. And I want to redirect us a little bit. A lot of what we've been talking about right now is children that have very severe vision impairment in the resources that they need. And the burden there is great. On the other side of that equation, though, there are many, many children who have something simple to correct. They need glasses, like I do, in order to see clearly and to correct their vision. And what we've noticed, to Dr. Harewood's point about disparities, is there are marked disparities across the United States in terms of access to pediatric eye care. And honestly, it happens at every level. It's whether screenings are happening in the community or by their pediatric providers or in schools. And it's when they don't pass those screenings, and that screening is often the first point of entry into the eye care system, that they detect a child who's at risk for something, and the parents are encouraged to go get an eye exam. But the activation barrier there is steep. You have to go find a doctor in your community that takes your insurance. You often have to take time off work. You have to deal with transportation issues to bring your child in for that eye exam. If your child is told at that exam that they are in this category of children that have uncorrected refractive error, they're nearsighted, they're farsighted, and they need glasses, they'll give you a piece of paper and you have to go to the next stop. You have to go to the optical shop, pick out the glasses for your child, come back often at a different date, get the glasses, and then make sure your child wears them regularly. And we now have, an abundance of evidence that every single step in that multi-step process, there are inequities in terms of access to screenings, in terms of getting the eye exams, in terms of wearing the glasses regularly, and getting them updated when they need to be replaced because they're lost or broken, or it's been, a certain amount of time since they've had glasses. And that has really moved the field of pediatric eye care into, are there alternate models? And that brings schools center to our equation of, well, there's a place that kids are pre-pandemic 7 to 8 hours a day, 8+ months of the year. Should we bring healthcare there? And there's a lot of examples of that already. There's school-based health centers, there's school-based vaccine programs, dental programs, asthma programs. And I would say over the past 10 to 20 years, but particularly in maybe the past 5-6 years, there's been a huge sort of push in this direction of bringing routine eye care services. And I'm going to emphasize routine because there are children who suffer from diagnoses like Stephanie has talked about that are well beyond the scope of a school-based program. But school-based programs have vision screenings happen at school. And then they have eye exams available right on site at the school for children who don't pass the screening. And that's often an optometrist or an ophthalmologist. They'll do that exam right there. And the bonus for many of these programs is they'll actually provide access to the glasses directly at school too. So one of the things that type of model does is, first, it brings all care directly to the school. So it takes out the issue of accessing care in the community. The second thing it does, though, is it couples vision and education, and it really emphasizes the interrelatedness of those two. So teachers know which students need glasses. school administrators and teachers can watch that improved engagement in the classroom for the child who is a -3 myope and who is sitting in the back of the room and not paying attention before. And so these programs are my area of research of how do we build them, how do we sustain them, how do we continue to improve and refine our evidence about best practices for them. But the caveat of routine is that there are going to be a percentage of kids. We estimate it's about 5 to 7% of kids in the school age population will find something more serious. And the challenge there, and we may cover this later in our discussion today, is how do you loop those kids back into the community?
Right. So many points that we'll have to discuss in our later questions, because I could continue to ask you questions about this. But I want to turn things over to Stephanie. I mean, as a parent, you've had to access these systems, and so you have quite a bit of experience. I'm curious how you have felt about accessing care and your perspective on how we could change things.
Well, first of all, I was sitting here in awe of your descriptions of your program related to school, Dr. Collins, because wow, would that ever be amazing? So I hope that that program, thrives and expands and enjoys continued success, because it sounds amazing. My family was very fortunate. We had visual and medical insurance. First of all, I want to say that I can't imagine having experienced a more caring community in all the providers that we accessed, whether it was the optometrist or whether it was the ophthalmologist and their offices and stuff. They were excellent at providing care, providing referrals to specialists, and helping us navigate that healthcare piece. Within that, there's always obstacles. Some of the ones that we came across is I found that there was a lack of pediatric specialists compared to the adult population. So often it was, it meant travel, which obviously is a barrier for many, many people, and the cost of the travel. Or people in rural communities, because most of the specialists or most of the pediatric specialists will be in larger centers as well. When you navigate the insurance arena, there's always issues with any type of healthcare. For us, it meant because we were needing to access specialists, it meant we had to go out of network. And so just navigating that whole system and getting exemptions and getting the insurance to okay it and all that kind of stuff, which, is an entire process. Or if you change insurance and the provider's no longer in network, you're starting all over again. But when we talk about system level improvement, I mean, access is the word that pops out in my mind. I mean, in whatever shape or form, access is imperative for kids to have, especially like Dr. Collins said, if it's preventable, if it's as easy as a pair of glasses and then continued follow-up from that to see changes. So a little bit of background, I'm Canadian and I'm from Canada. So whether we agree with different healthcare systems, they all have their advantages and they all have their disadvantages. But I want to throw out there that I had an exam by an optometrist every year of my first 20 years of life, because that was provided irregardless of my parents' income, where I lived, wherever wherever we are. So having lived in the States for the last 25, 30 years, it's really gut-wrenching to know that we aren't taking care of our children at a very basic level. So at a higher level kind of system improvement and stuff that, we need Congress and people higher ups to work on and stuff is access for me, because so many of the kids fall through cracks and stuff. I see that in the Affordable Care Act, where they're building an annual eye exam into essential services in healthcare, because so many times healthcare and eye care are separate entities. So I kind of looked at a more higher level type of things, of some of the things that I really think as a nation we need to continue to address.
As a fellow Canadian, I think about that every single day.
Yeah.
So I understand completely. I'm also curious if there are models of team-based care, other models of team-based care that you think would be useful in the pediatric eye care space. Now, Dr. Collins?
I am not Canadian, but I did my fellowship at Sick Kids, so I feel like I should get some token Canadian status here.
You get
Uh,
some token status.
and I completely agree with what Stephanie said because, I had kids come to me from all over the province of Ontario and other places within Canada, as well as some countries that they had reciprocity with in terms of healthcare. And we didn't look at an insurance card. We gave everybody the care that they needed to have, and we didn't worry about, oh, if we send them back out into the community, they're going to see this provider who doesn't take their insurance and deal with all of those issues. So anyway, not to get on my soapbox there. But in terms of systems, I think there's a couple different angles to think about here. One is to circle back to school-based vision care. I think that the system of taking care of some pediatric eye care needs within the school, within communities where it's needed. Now, there are places where kids are accessing care regularly when they need to access care, and they have the resources and they have the insurance coverage to do so. But because of very deeply running inequities in this country, there are a lot of places that are not. And some of the places that are hit the hardest is some of our most disadvantaged and highest poverty school districts. So building systems there with the local stakeholders. Stephanie mentioned doing some vision screening with Prevent Blindness in Baltimore. Our partnership is our Baltimore City Health Department and our school systems work together with us at Johns Hopkins and Vision to Learn. It's an optometric nonprofit. They come in and do the eye exams, and Warby Parker generously donates the glasses. But we've built a system of across providers who have a shared common goal of giving kids the eye care that they need. We can also think about systems for kids who have more complicated eye problems. So say they're from a school-based program and they need to come in and see a provider in Wisconsin or New York or in Maryland. How do we do that? And I love how Stephanie described her experience in Wisconsin in terms of the providers talking to each other and helping Stephanie and her child navigate the system. Unfortunately, I feel like I don't hear that story all the time. I hear a lot of stories of parents saying, well, and it resonates so much, Stephanie, for you to say there are a lot of pediatric subspecialty providers when it gets into you're talking about it's pediatric cornea or it's pediatric glaucoma or it's pediatric retina. There are not that many people who have that niche focus. And so as a parent, you're sometimes struggling and somebody sends you to one person and then another person and then another person. And not only is there sort of the harrowing experience of having to go to multiple people, but they don't talk to each other. And sometimes their systems don't talk to each other. This one's on paper notes, this one's on Epic, this one's on another electronic medical record. So you feel like you're repeating your story multiple times. And they don't then talk to if your child needs low vision services or needs something within the rest of the body. Sometimes they don't talk to those other providers. And Joy, you and I had discussed this the other day, and it sounds like you've had some experiences at SUNY and I've had at Hopkins where multidisciplinary care clinics for kids with complex conditions. So genetic issues, oncology issues. I work with the craniofacial malformations team. So if you have a child who has, I need to see a geneticist, I need to see a pediatrician, I need to see a neurosurgeon, I need to see a plastic surgeon, and I need to see an ophthalmologist, there are places that will bring that multidisciplinary care together. And talk to parents and partner with them in that process. And I think that's a model that we should aspire to in vision care. If you have a child who happens to have a cataract and glaucoma and a retina issue and they need a routine refraction, trying to figure out ways that we can have all of those providers talk to each other. It gives patients, I think, the best care, but it also, I think, gives parents the most sort of satisfying experience that they feel like people are on the same page with them. Because I think anxiety and, we talked a little bit about mental health of children going through this, but I would also emphasize the mental health of parents going through this for your child is hard. And Stephanie, I'm sure you can attest to it's hard to watch your child suffer. and the sort of pressure parents feel themselves when their child is struggling. I think having systems that integrate more efficiently can help reduce some of that.
Now, Stephanie, can you expand upon that? There's so many different pieces, and I think
Sure.
what you're saying complements each other.
Yeah, I mean, I think we could have a discussion for many, many hours on so many of the topics that we've touched on. Um, so two thoughts that stick out after, and talking about of systems and supporting people and stuff. So when I participated in an empowerment event with Prevent Blindness Summit, we had the opportunity to sit together at a table with providers, geneticists, researchers, parents, people with vision impairment, and really have some dialogues. So one of the thoughts or one of the themes that came out of that was the idea of patient navigators. And so I just wanted to touch on that for 1 second, because it's just yet another system, and I'm beginning to explore and understand and potentially see what could happen. So a patient navigator, when you look it up, if you Google it or whatever, you think of it often for cancer care for different things. So it's a nurse navigator in the hospital that helps a patient navigate the entire system and bring professionals in different disciplines together. So they remove barriers to care, hopefully. They help navigate the healthcare system. They promote health. They provide education. They provide support for all the different players in the system. And they can mobilize resources for people as well, or be an asset or a source of resources. So it got me thinking. So in a complex medical situation, like for maybe one of my kids, some sort of patient navigator in an office setting could be a support to everyone, from you as professionals to us as procurers of those services. But what about community patient navigators, not patient, but community navigators? And where do those fit into really address many of the preventable issues around determinants of health? So where people live, their education level, their access to healthcare, their community resources, all the things that are barriers for people to access care. How would a community navigator be able to help that? And would they work in the school system? Would we incorporate agencies like the Lions, who are dedicated to vision care, and have put them in as resources? I think you should explore, and we should continue to explore, all the different types of systems and places where those systems can work, because there are so many organizations, but unfortunately they all don't talk or work together. So I think that we are rich in resources and people that want to do it. It's just coming up with those systems and putting them in place and making them work. So just a couple thoughts to share in response to thoughts you triggered in my mind.
Joy, can I react to that?
Absolutely.
I just think that's so important, because it is true. And I think there's this like sense of being overwhelmed as, maybe a patient or a family member, and you Google something and all of a sudden you find like all of these different resources or organizations, and you don't know which one to go to, and you don't know which way to turn. And part of the issue of access is trust in education, and knowing I can trust this provider, and feeling that they have my best interest. And again, I think that underscores a lot of our disparities and our healthcare inequities, as people are mistrustful of the system and of the care that they will receive, and what their diagnosis might be in the first place. And part of that is related to the history that they have experienced. But part of it is also related to issues of educational awareness of, do children have vision problems? Will giving you a child glasses harm them? So I think there's so many things in terms of community navigators that can not only sort of harness the existing resources that are out there, but also help to promote a lot of education and build those bridges that don't always exist, that If a community navigator has a positive relationship with a healthcare provider, then perhaps a person who lives in that community that may not have otherwise known or trusted that organization will feel more likely to utilize and access care there.
No, definitely. It makes me think towards a hospital that I used to work at in the Bronx, and we started to lean more heavily upon community health workers. Now, although they didn't have, one would say, the level of healthcare knowledge, they had this cultural fluency that we did not have within those communities. So they were able to kind of translate some of the information a little bit better and help to build more trust. And that brings me to my next question. How do we do that? How do we do what Dr. Collins was talking about? How do we build that trust within, patients, providers, and in between the two? Because when we speak about these diagnoses, or even if we're giving someone a pair of glasses, without that trust, sometimes we're not believed. There are many different things that can happen. So either Stephanie or Dr. Collins, either one, if you'd like to comment about that trust, would be wonderful.
Stephanie, do you want to start or do you want me?
Sure. Yep, I can start. So I think a lot of the things that we talked about involving communities and about involving different agencies within the communities and starting where the patient or the children that are getting those screenings are, starting there. Some of it, I think, starts with building awareness. A lot of it, like we've talked about, school and pediatricians' involvement. I think it's probably more common for children to have access to pediatric care than it is to necessarily specific vision care. And I don't feel like we didn't necessarily experience a huge connection between the pediatrician and vision care. And I think that is an area of work, and I think it's really unfortunate. On another question I had prepared, but it seems to be relevant right now. My kids, when I was looking up, or trying to remember when my kids had vision screenings at their pediatrician, it's not every year. There's an outline kind of set up by the Pediatric Association when they do it, and they're just doing screenings. Looking back to when Brandon was young, a lot of times they do those without even mentioning it, it's a visual thing, especially when the kids are young. But had they told me that I think it's American Optometric Association recommends a screening between 0 and 12 months, or 0, at different intervals, full vision, exams, that would have been nice. So I think connections between there would go a long ways. I think, Dr. Collins, you had mentioned on another webinar, intergenerational strategies. So focusing on family care and stuff. And after that, after you had explained it, it really got me thinking, I don't think I've ever been to an eye appointment, because I wear glasses and contacts, where someone has asked me, well, are the rest of the members of your family coming in for care? Or could I bring my kids in with me that day and we can all have exams? So I think there's some real possibilities there as well. But truly to build that, to engage people and to build that trust, I think you have to meet people where they are, whether it's with community organizations that they're involved with, exact community locations that they frequent, and many, many other ways. The healthcare system is overwhelming for all of us, even for professionals. If they go to a different area of healthcare where they don't know anything, it's overwhelming. And so helping for people that are disadvantaged in a variety of ways, which is, can be everyone, what are those ways that we can help overcome those hesitations or those barriers to access?
Dr. Collins?
Stephanie has said so many things that kind of.
I know that was too many things. That wasn't just one. Sorry.
One of the things that I would say that I have learned, and I feel like the medical system needs to continue to remind itself of, is check our assumptions about why people are not accessing care. And is it simply that there are not enough providers in somebody's area, or is it that there are other reasons they're not coming to a provider? And understanding that. And part of understanding it is not just saying, we have, X million kids who need glasses. We'll bring care into school, and then everybody will utilize school-based vision programs. What we learned in building our program is how important it was to be part of the community, to go to schools, to talk to teachers, to talk to parents, to really immerse ourselves in the community and understand what their experience was, and build these sort of educational partnerships from the ground up. And I think there's so many examples of where you can expand that, even building better relationships with community providers, bringing eye care providers into FQHCs, because I think there's always the assumption that in order to address eye care issues, we have to bring kids into hospitals and clinic settings. And I think we're moving away from that. I think we're being disruptive innovators in healthcare now of delivering care in schools. But there's other examples of how do we bring care into the community rather than bring the community into the healthcare setting as we have traditionally done. I think can be incredibly valuable to think about. But part of doing that is having more education, more engagement, more spending time in the community. I will fully admit that before I started working at Johns Hopkins, I had never been in an elementary or a middle or a high school since I was in elementary, middle, or high school. I had never, in other communities that I had worked in, whether it was in Chicago or it was in Wisconsin or it was in Toronto, I hadn't known what a child's life in school is like, or their transportation issues might be like. And going out into the community and learning that as a provider can be very eye-opening, no pun intended, and really enlightening. And I think starting there, learning where people are and what they need and how you can work together, and recognizing that I think there's this shared interest of improving health, well-being, and learning for children. I think all of us are on the same page there. But how do we do that? And how do we do that sort of incrementally? We're not going to change everything in one day. We're not going to be able to change it all in one day. But building those partnerships, leaving some of those assumptions aside that we've had in the past, I think are a really important first step.
Absolutely. And the broader social impacts could even be, once you go into these communities, potentially more people from these communities that are underserved will want to become you. You can't be what you can't see. I do want to turn things to the chat for a moment. We got one question about school systems. So how can we connect to school systems on the state and local levels to understand what policies, systems, and resources, experiences are in place, and what can be different? How can we improve? Now I'll turn that over to Dr. Collins. Do you want to start on that?
Sure. I get this question a lot now that we've had a lot of success with our Vision for Baltimore program. I have other stakeholders in Maryland or other states say, how can we do something similar? And the first thing, and this relates back to the comments we were talking about having a community navigator, is honestly starting with a landscape analysis of what exists in your state or in your school district or in your community. Because sometimes it is leveraging existing resources. It's honestly very rare that you have to start entirely from scratch, but it is understanding what exists. So I'll give you an example. For Maryland, it's understanding what grades the state currently mandates vision screenings in, and whether those are actually implemented in schools or not. And then it's understanding, are there current school-based vision programs or other community events that happen to offer eye exams and glasses for kids, and are those being utilized or not utilized? And then building a system of connecting all of those pieces together, which is doing the screenings for children so we figure out who's at risk, giving them eye exams, giving them glasses, doing all of the education with families around what does it mean to have a screening? What is a screening? What is an eye exam? What does it mean to get glasses? What are the long-term implications of getting glasses? How do you take care of glasses? I feel like that is honestly one of the most common questions that teachers ask us, because kids are kind of messy sometimes and they get their glasses really dirty, and teachers often ask, how do I help with that? But I think there's all of the elements of understanding a landscape analysis and then building a system based on what exists and sort of exploring further opportunities to strengthen existing programs when they are there.
For sure. Stephanie, do you have any commentary on how we connect school systems at a higher governmental level?
Not nearly as much as I had to say for the last one, because that's a little bit out of my wheelhouse. I guess another thing, when I think of higher level stuff and reaching policymakers and creating those high level systems, I guess. So as a parent, I'm questioning, well, how can I help? Obviously, I'm not part of a system that's, developing and working towards this, and I might not even be aware of most of those systems. So it makes me think as a parent, I guess, of two things. Of one, getting involved with local organizations, and the importance of reaching out to the community and organizations, and becoming involved. And some of that might be advocacy work, because some of these higher level policy changes, that's what it takes. Grassroots effort, but also, some formal advocacy. So, for instance, I've been involved with Prevent Blindness, and another organization in my state is the Wisconsin Council for the Blind and Visually Impaired. Both those organizations do a lot of advocacy work. So they're working towards, addressing accessible voting, special education funding for the school system, transportation, DVR for technology resources, whatever it is. Organizations like that will help, first of all, help you identify and become involved with advocating for change and the tools in which to do that. They can help you locate, local, state, national representatives. And in the same way, if you have things that you feel strongly about, they're there to support you in bringing them forward and starting a conversation if it's not somewhere else, and connecting you to resources. So, as a parent trying to contribute to higher level change, I think that's one of the important things that we can do. Also, as I'm doing a little bit through this webinar, becoming a storyteller, because I think for those, or I'm learning for those higher level changes, it's important to hear from families and people that have had experiences with vision loss or vision screenings or whatever it might be. And so lending my voice and I guess my thoughts to help advance and create change is another way that you can contribute as a parent.
Yeah, it's a vitally important voice. And we've been talking a lot about screenings, and talking about eye exams. And I think it might be important to really just define from both perspectives, what are the separation between those things? I think sometimes there is some confusion amongst people who don't deal with it every day about what's a screening versus what is an eye exam. Dr. Collins, you want to comment?
Sure. So it is a commonly confused, as Joy, I'm sure you have experienced and I have experienced, in all of our eye care colleagues have experienced, a screening versus an exam. What's the difference? So a screening is an assessment that is typically done by a technician or a school nurse. If it's in a pediatric office, sometimes it's done by a pediatric nursing staff member, and it is a cursory assessment to detect a child at risk for a vision problem. It can include sometimes checking a child's distance vision. So that's when you see the child standing in the chart across the room with the big E. Nowadays, it's more common, particularly in the preschool population, but some in the school age population to do what's called instrument-based screening. So you have a device that honestly looks like a glorified Polaroid camera, and that you focus it in front of a child, and it gives us a reading that helps decide who passes their screening and who needs to be referred. Children who are referred from screening, or quote unquote have failed a screening, although we're trying to get away from that term, need a full eye exam. They need an eye exam by an optometrist or an ophthalmologist to understand why they failed the vision screening. Now, for some small percentage of kids, they failed the vision screening because they weren't paying attention, or they were looking across the room rather than at the photo screening device, or they really want glasses, so they faked that they couldn't see any of the letters, and they passed their vision exam. But for most of the kids who fail a vision screening, it turns out that they have some type of vision problem, falling into those big categories of refractive error, needing glasses, or other ocular conditions and diseases like amblyopia or glaucoma, cataracts, all of the other things that we hear about that happen much more commonly in adults, but sometimes in kids. So those are the big distinctions. States mandate vision screenings. I think 41 or 42 states in the US mandate vision screenings at certain intervals for school-age children. I don't know the numbers for preschool children, but most of the states mandate something for preschool children too. And this is also supported by most of the major medical associations, including the most of the optometric and ophthalmology associations, the American Academy of Pediatrics. And the idea is that if you start with a screening, you'll triage out who is at risk and who's not at risk. Does that help, Joy? I feel like I'm going on
Absolutely.
and on too.
Not at all. That was probably one of the most complete explanations that I've ever heard, so I appreciate that. Now,
Joy, I was going to add one thing to Stephanie's point about the power of the narrative and why the story is so compelling. And I listened to, Stephanie, I've now had the opportunity to hear you a couple times, and every time I'm honestly as mesmerized as the time before. And I think when we're thinking about how do we access policymakers and how do we talk to them about system level change, I can go in there with all of my data and all of my papers and not get anywhere. But when we have partnerships between parents and researchers and providers, and we collectively talk about the story and then some of the data behind that story, I find that is what I'm hopeful will be the most effective at bringing about change, because people really relate to understanding the personal journey that a child or a parent may have gone through, rather than my like 5,000 charts and this number is statistically significant and this one isn't. So trying to build the parent and provider partnerships even more is really important for that system change too.
absolutely. Now, Stephanie, you can respond to anything that Dr. Collins said, but I'm curious in terms of your own experience with screenings versus examinations. Do you feel like it was made clear to you in terms of what those distinctions were? And do you think there were ways that it could have better been communicated what you were getting into with all these visits?
Sure. And one quick comment to feed off your last comment. I absolutely believe that the partnership, and when you're presenting information, having the facts and the data and the studies, and then the emotional side, I think is most impactful. So just a quick comment to totally agree with you there.
Stephanie and I are going to be going to Washington.
We do well, hopefully. So neither of my children, Brandon or Hunter, ever received a vision screening in school. And so I do have a couple of the numbers. So only 54% of states require vision screenings in schools, which is pretty sad. And there are 10 states that don't require testing in any kind of school age at all. And of course, Wisconsin is one of them. So my kids never had any preschool testing at all. Brandon was, I talked about his teachers. The preschool that he went to, they had Prevent Blindness did preschool vision screenings for them every year. So while Brandon wasn't identified through the screening, those teachers knew what to look for. So that is the only type of screening in the school system that they received. Hunter received vision screening at his pediatrician office by, I think, the nurse practitioner or whoever would do it. Brandon never did, because by that time we had access to other care, and we just said, he's never going to see that letter, don't bother doing it. We already, we had made other connections. I don't know if at that stage of our lives I ever appreciated or realized the difference between the two. I think I could realize that a screen, knew the difference because of who they were done by, that the screening was done, by the pediatrician's office, the staff there, or potentially in the schools, which I didn't even know they did. And because I have glasses, I knew that I went to an optometrist for a vision exam. But what wasn't clear to me so much as the distinction is what I should be doing, I guess. And in looking back, it would have been nice for potentially the pediatrician, anyone really, but that maybe would have made more sense to say, you know what, this is the deal. We do vision screenings this often. It's also not a bad idea for your child to go and have a full exam at certain intervals, whatever they might have recommended, by an optometrist or by an ophthalmologist, even if you don't see things as they're entering school or at those critical stages of development. So what I wish would have happened is that discussion would have happened, or as a new parent, not knowing anything about this bundle in my arms, and there's so many things going on, that someone would have taken the time to say, you know what, this is also something you just need to be aware of. Because I think lots of parents, it's not on their radar that kids should be, maybe the school screenings are happening without them even knowing, right? They only know that they happened if their child was flagged or didn't pass the vision screening. So I think there are many parents who aren't even aware that it's something that should be done, or that is healthy and good to be done for your children. So not so much not knowing or understanding the distinction, but knowing what suggestions they might have. And that's a regret that I think, could be worked on.
Absolutely. Now, I know we're winding down on time, and there are many questions that will remain unanswered. I do want to address one that's in the chat regarding the progress on pediatric eye care development in the New York area. And I wish we had the same system that Dr. Collins has in Maryland. But from what I know of, we don't have that same type of model. And we do at SUNY College of Optometry, we go into a lot of schools and do a lot of school screenings, and we have programs that do that. But in terms of actually having the provider actually doing the eye exams there, I mean, Dr. Collins, if you know of any, you can definitely comment on it. But
yeah, Helen Keller International does a lot of work within New York City. So, but you are outside of the New York City school system. So it's a good question, and it's definitely, one of my areas of interest now in my role at Hopkins is how do we take some of the evidence and the power of the narrative of what we've been able to do in Baltimore and bring it to other places, because I think it's a profoundly transformative model. It is not, it's not rocket science. Honestly, it's one of those things that there's a lot of things in the world that we can't fix. There are a lot of eye problems that we can't fix, but there are some that we can. So there are, knowing that the disparities are there and that we have a proven model that can come into school systems. I think Sandy Block was on here for a while. She's been integral to the development and continuation of one of the big programs in Chicago public schools. Helen Keller is in, I think, 8 different states that they've done programs. Vision to Learn is now, I think, in 13 states. So there's progress in that direction, and there's more that is happening, but there's still much more work to be done.
Absolutely. Now, I think the question that might be the best, given that the name of this is building stronger relationships, building stronger systems. How do you think we put all these elements together? So how do we engage? We have that interdisciplinary engagement, that interprofessional engagement, and that community engagement where we're really bringing patients and parents into the fold of eye care to advance many of these challenges that we've spoken about. And I'll turn things to Stephanie first.
So my first thought that pops into mind is we have just this amazing web of resources, agencies, academic institutions, programs that are all working towards common goals, really. And hopefully they'll continue to work, and really just the web will get, tighter and tighter and fill up all those holes that are there. However, there's that same web of all those wonderful agencies is also frustrating as a consumer because you don't know where to go. And we've talked about that in the past. A lot of times they aren't communicating. So a couple thoughts. One, how do we bring those entities together, and how do we begin discussions within those entities so that they can collaborate and share best practices and stuff like that, and then help consumers like myself or my children. So again, some of this is obviously beyond me as a consumer, but interdisciplinary conferences, bringing together nonprofits, physicians, researchers, government entities. When I was part of the Empowerment Summit, that's a little bit of what they did. We all had common goals that we were working towards, and started that dialogue and made those connections that I feel like I can reach out to now, and others do as well. So ways to just start that dialogue, I think, are helpful. And if those conferences do exist, which I'm sure they do, sometimes they aren't involving everyone. Like maybe some of the nonprofits, or maybe some of the consumers themselves aren't as involved, and they become less robust in that way. But during those types of gatherings, however they happen, having not just presentations, but discussions, I think, is also important, because I think that's where the change happens, is in those networking abilities, or those discussions that happen maybe after presentations. So building that type of format in to be a real focus of those, to build community, bridge those gaps, and continue to move towards the change that so many of the agencies are already doing.
Absolutely. Dr. Collins?
Again, so many things to react to there. Where do I start? I completely agree that one of the things that we need to continue doing, and today is a perfect example of Vision 2020 sponsoring this, is having more conversations, and having more conversations across stakeholders, and thinking really broadly about stakeholders. I think Prevent Blindness National Summit is another great example of where they bring together so many stakeholders in the vision space. In the school-based vision care space, one of the areas that I think we are starting to get into, but it will be increasingly important, is actually getting more engagement from the students themselves who have benefited, and their parents. And again, it gets back to the power of the narrative, their experience, and their, putting in their words what a screening versus an eye exam is, and what it means to get glasses, or what it means to have a more complex eye problem, and how that has impacted their education, their vision, their life experience, I think is a really powerful way of building these relationships that we as providers need to hear, we as nonprofit stakeholders need to hear. And it gets joy to, I think, an area that you and I are both interested in, is how do we increase the diversity in the pipeline of the workforce of people who are thinking about STEM careers, and people thinking about pediatric eye health careers. I'm obviously biased towards pediatrics, but I'm happy for them to do any eye health. And it's starting those conversations and having those awareness of what's going on. We do vision health fairs. We actually did one pre-pandemic on World Sight Day at one of our local schools, and it was a school-wide event, and we had all of these different stations. It was, supported by Wilmer and Hopkins volunteers who were teaching kids about stereo vision and color vision and testing vision. And kids get so excited by that little bit of knowledge and continuing to build that in. So very early on, they understand and they start to get the science and they start to get the connection between science and learning. I think long term, by building those relationships with the youth, I actually think that's probably the place where we should focus a lot more effort than we currently do, because the youth are our future. And the more that we build trusted relationships with them and we continue those forward, I think the more impacts that we're going to make in all of the directions that we're trying to address.
And I could not agree more. We are looking more towards high school when it comes to diversity and inclusion related initiatives and trying to get people involved at that level. And again, as we were saying, once you're exposed, you want to get an exam, you want to become an eye doctor. And it really helps to solve things that are really difficult to solve individually. Now, I know we're at 1:15, so I'm going to invite John to come back on, but I can't say enough. Thank you to Dr. Collins and to Stephanie for sharing that story and sharing your wisdom. I think it was just such a rich conversation that probably could have taken 2 hours. And there's much more that we can address, and hopefully we'll address them in the webinars to come.
Thank you. I love the mention that this is a conversation. This concludes our World Sight Day 2022 Congressional Briefing. We hope you take away from the discussion new information and insights on improving diversity and access that enables us to serve our constituencies and beneficiaries more effectively, in better quality, and greater understanding. I want to conclude by thanking those who attended or attending, our moderator and speakers for their really excellent and insightful presentations, the organizers and sponsors that made the event possible. And finally, stay tuned for announcements of upcoming webinars and further discussion. Thank you, everyone, and have a wonderful World Sight Day.
Thank you.
Thank you.
Thank you.